Good morning. Thank you for joining us for Impact Tuesdays. I'm Jennifer Krishka, CEO of the Jewish Women's Foundation of the Greater Palm Beaches, a social change nonprofit dedicated to advancing the status of women and girls in the United States and Israel. Please note that your microphones are muted during the webinar. We will open up the conversation for questions towards the end of the webinar. If you would like to submit a question, please do so through the Q&A feature, which you can find towards the bottom of your screen. So today we are joined by Dr. Lawanda Ravoira, President Emeritus of JWF grantee, Delores Barr Weaver Policy Center, which is based in Jacksonville. So we will go ahead and get started in a couple of minutes. It's only 1 minute after 10 o'clock. So let's just sit tight and we'll get started soon. Thanks. And here she is.
Good morning.
Good morning. Welcome, Dr. Ravoira, and thank you for being here with us today.
Thank you.
I just did our brief welcome and we are ready to go ahead and turn it over to you.
Great. Thank you so much. And I'm going to ask for my technology support to share the screen with my PowerPoint. So thank you.
Okay, great. Thank you.
It says host disabled participant screen sharing.
Oh.
So Jennifer, I need you to.
Yep.
Great. The technology works, so thank you. And I want to certainly thank the Jewish Women's Foundation for giving me the opportunity and for your incredible support of the Florida Justice for Girls Florida initiative. I want to share with the participants on our webinar today that we'll be really focusing on sharing who we are, the Delores Barr Weaver Policy Center, as well as the Children's Campaign, who is our mission partner, who is leading this work across the state. And I'll take just briefly and share what the Justice for Girls advocacy movement is and our goals for that, and what we've learned from the research across the state about the needs of girls in every corner of our state. And also why strategic advocacy is more important than ever in this time of the pandemic that we're all navigating, and how we together can fight for the lives of girls in the state of Florida. For those of you who aren't familiar with the Delores Barr Weaver Policy Center, I'd just like to take a brief moment and share a little bit about us and invite you to go to our website, seethegirl.org, if you're interested in learning more. The Policy Center was launched in 2013 here on Florida's First Coast, and we provide direct services in the 5-county area of Duval, Nassau, Clay, St. Johns, and Baker counties. And the Policy Center is the progression of the work that the Children's Campaign and I had been doing for several decades on elevating the needs of girls in the justice system. But what we found in this community at that time, Jacksonville, Duval County, was incarcerating more girls than any other county in the state of Florida. In fact, we were incarcerating more girls than Miami, Tampa, and Fort Lauderdale combined. So we made a decision, if we could focus on this area and show how a community could come together to change the way we respond to girls in the justice system, that it would also give us an opportunity to show other communities that they can do the same work. So the mission of the Policy Center is to engage communities, organizations, and individuals through research, community organizing, advocacy, training, and model program to advance the rights of girls and young women, especially those impacted by the justice system. Our model programs consist of Girl Matters at Elementary, where we are working with girls in elementary school who are being suspended. We have Girls in the Middle, where we work with young girls in middle school. Girls in the community are girls who we serve in diversion, in the detention center, in the courtroom, in the community, and also those who are in the pretrial detention center. Wherever the girls are, we bring the services to them. And we also have the Open Doors Outreach Network, which was started at the Policy Center in partnership with the Children's Campaign to address the specialized needs of trafficking survivors. And Open Doors has now been replicated in 32 counties across the state of Florida. Our Girl Matters It's Elementary program has been replicated in Virginia. The tagline of the Policy Center is "See the Girl," and I share this because it actually was the call of action from a young girl that I met many years ago who was locked up in Florida's juvenile justice system. And when I asked a group of girls what it was that they would want policy makers to know in Tallahassee to change how girls in the justice system were treated, this wise young 14-year-old who had spent most of her young life behind razor wire simply said, "Tell them to see me for who I am, not who they think I am. See me for who I can become." And so See the Girl is our call to action, and we hope that it will become the call to action for the state of Florida. The four pillars of the Policy Center really inform each other. We begin with research, and this research is grounded in the lived experiences of girls. And in just a few minutes, I will share the highlights of some of the statewide research that shows the critical needs of girls in our state. What we learned from the girls is then integrated into our model program designs, as well as our training and technical assistance. We have an annual See the Girls Summit. We also have a partnership with Georgetown University where we will be launching a certification program and training jurisdictions across the country. But of equal importance is our advocacy work, because what we know is that we must change the policies and the processes and the practices that continue to keep our girls in a lifelong cycle of poverty. Our mission partner, the Children's Campaign, was founded by Roy Miller in 1992, and the Children's Campaign really is a watchdog organization that's housed in Tallahassee that does work across the state of Florida and also nationally. And they really work in a nonpartisan way to initiate change for Florida's children and families. The Justice for Girls Florida initiative, which was launched a year ago with three very bold goals. One was ending the disparate treatment of girls and young women and youth who identify as female, who are part of Florida's juvenile justice system. And also to change the policies and practices that trap justice-involved girls into a life of poverty. And the third goal is to develop a Florida-based research capacity to introduce and spotlight issues, to monitor progress, and to support the improvement of policies and practices through a girl-centered or a gender lens. As we are all sharing this experience that we've never experienced before with the pandemic, we know that advocacy is more important than ever, and particularly for girls, because the disparities that existed before the pandemic are exacerbated now during the pandemic, and they will not go away when this finally ends. Before I share the research with you, I want to just share a few highlights around why this advocacy is so important. What we know is that girls who end up in the juvenile justice system, this can be the worst outcome for girls. And it's often where we have failed them in the child protection area, where we have not provided the mental health services that they needed at the community level, where they have been pushed out of school, and they end up in the juvenile justice system. But what we found from the research with girls in middle and high school, and these are girls who are not in the juvenile justice system, they are in the general population, is that there is a population of girls, and it's much larger and across all socioeconomic groups and in every corner of our state, where we are seeing girls in crisis and girls being left behind. And there is an urgency that we have to address what's happening in schools, what's happening in the child welfare system, what we are seeing with the increases of reports in sex trafficking. There's a population of invisible girls that we saw in the research that's not showing up in school, they're not showing up in work. That's 12,000 girls in our state that we're not sure what's happening to them. We also saw incredible disparities in rural communities and the impact of the unaddressed mental health needs. And girls are being left behind already, and they will be further behind as this pandemic continues throughout our state and our country. I'll begin now by really sharing some highlights of the research, and I don't have time to go into depth, but I wanted to at least give you a sample of the urgency of the call to action to change what's happening to girls in our state. We have 4 major research publications that you can go to our website, seethegirl.org, and download these and read them in their entirety. The status of girls' well-being, the status of girls' educational attainment, what's happening to girls in secure detention in Florida, and breaking the cycle, the policies and practices that continue to create barriers that trap young girls in poverty. We know that not all girls' experiences in the community are the same. So Vanessa Patino-Lydia, who is our Vice President of Research, led this research by looking through multiple lenses: the gender differences, the racial and ethnic differences, the differences in sexual orientation, and geographical differences. So I want to give you some of the highlights statewide. And when we looked at the status of girls in educational attainment, there's much to celebrate. We do know that we are seeing higher rates of graduation for girls. We're seeing more girls entering college, but there are pockets of girls and cohorts of girls that are not faring as well. Statewide, 1 in 3 girls report that they do not feel safe in school. And 1 in 4 girls reported they don't have access to talk to a teacher. 2 in 3 girls in middle and high school report that they experience verbal bullying, and 1 in 3 girls are experiencing physical bullying, and 1 in 3 are also experiencing cyberbullying. When we looked at experiences of girls in their community statewide, we see that 1 in 8 girls do not feel safe in their neighborhood. And 1 in 10 girls, and these are girls who are in middle and high school, are reporting that forced sexual intercourse or rape. The research publications, I'm showing this one slide just as an example. Much of these indicators were divided by county so that you can go to the research and see how your county is faring on the indicators for school as well as well-being. And for this webinar, wanted to take a closer look at girls in Palm Beach County. And we see that 1 in 10 girls don't feel safe in their neighborhood. More than 1 in 3 girls don't feel safe in school. 1 in 5 girls in Palm Beach County are reporting they don't have access to a teacher to talk with. And you can see that 27% reported physical bullying, 56% verbal bullying, and 29% cyberbullying. And 1 in 10, which is comparable to the statewide statistics, report forced sexual intercourse in Palm Beach County. And I want us to keep in mind, behind all of these statistics is a girl. It is a girl who is experiencing this isolation, these feelings of disconnection, and violence and trauma in her life. Also, when we looked at Palm Beach County, the indicators of well-being, we see that 1 in 3 girls feel that life isn't worth it. And 1 in 2 girls in Palm Beach County are using substances, and 1 in 5 girls are thinking about suicide. I'll pause for a moment because I know that these statistics are heavy for us to hear when we think about how we would envision life for a girl in middle school, a girl in high school. This is not how we would envision their day-to-day living and how they are seeing their lives and their future. But when we think about girls in middle school and girls in high school who are experiencing this kind of day-to-day living, I want to also take a look at the girls in Palm Beach and how they were feeling in those who are impacted by the juvenile justice system. And we will start overall with what's happening to girls who are being pushed into the juvenile justice system, which is often ill-equipped and ill-prepared to deal with the gender-specific needs of girls. In the state of Florida, over 9,000 girls were arrested last year. Over 2,000 girls were in secure detention, and 340 girls were locked up in residential programs. Part of the good news here, back in the 2000s, and we were seeing as many as 1,000 girls locked up every day. So we are seeing a significant reduction of girls going into residential lockup. But we have to also pay attention to what are the needs of the girls that are getting pushed into the detention center and into the juvenile justice system. When we look statewide, we see that 57% of the girls' parents or someone in their household, caregiver, had a history of involvement going to prison. 18% had dropped out of school, 71% of the girls had a history of runaway, and 54%, or over 1 in 2 girls, have a diagnosed mental health problem. And this is at intake. We know that these statistics are even higher once the girls share more information. And you can see the comparison with boys. And girls are higher in every one of these categories. In Palm Beach, there were 450 girls arrested, and you can see the breakdown by race. And we continue to see the overrepresentation of girls of color pushed into the juvenile justice system. 14 girls were incarcerated, and of the 12,000 girls that I spoke about earlier that aren't showing up in school, they're not showing up in the workspace, 616 girls ages 16 to 19 are not in school or not in the labor force in Palm Beach County. I don't have enough time on the webinar to really go deeply into trafficking, but I thought that this was an important slide to look at from OPAGA because we can see every year the increased numbers of verified victims, of investigations, and of reports for sex trafficking. And we know that the state of Florida receives the 3rd highest calls from the hotline for reports of trafficking. This is a major issue in our state and in communities across our state. So the research is really important because the research becomes our call to action. We have to understand that girls across our state are suffering, girls across our state are in crisis. And when we launched the Justice for Girls initiative, we were focusing on girls impacted by the justice system. But the latest research that looks at the status of girls' education, the status of girls' well-being, we realize we have to really broaden our scope because we have a large cohort of girls who we are losing. They are feeling life isn't worth living. They are contemplating suicide. They are falling further and further behind. So we have expanded it not just to focus on girls in the justice system, but to focus on girls across the state of Florida. And what we know, programs and services are vitally important in our communities. So we don't negate that. And we advocate for expansion of services that are gender responsive, that really are grounded in girl-centered practices. But what we also know, we cannot program our way out of the disparate treatment of girls and the resulting intergenerational poverty. We must identify and change policies and practices that put vulnerable girls at further risk. And the Justice for Girls initiative uses a girl-centered lens to do our work. And I want to pause for a moment and really talk about why that's important before I go into the details of the Justice for Girls initiative. We live in a society where gender norms really define acceptable and unacceptable behavior. And we may think, well, what does that really have to do with this kind of statewide advocacy initiative? It is critically important because it is these norms that impact school discipline practices. And we see significant numbers of girls being pushed out of school for really minor infractions, things like disorderly conduct, dress code violations, tardiness, disruption in class, and fighting with peers are some of the things that we see in the research and that we see in our own practice. But what we also know that there is a less of a tolerance for girls acting out behavior because of these norms. We also see in our schools an overuse of Baker Acts. Girls who are in crisis are being Baker Act and involuntarily committed into mental health services. And if you think about that from the lens of just recently seeing a 6-year-old who was taken out of the classroom, or we're seeing young girls in 1st and 2nd grade who are being handcuffed, this is a continuation of trauma and victimization of girls because we are not preparing professionals to effectively work with girls, or we're not giving them the resources that they need to actually address the serious issues that the girls are bringing into these spaces. We also can look at girls are 64% more likely to be committed in lockup for a less serious offense than their male counterparts. And this is acute for girls of color. So when you have girls of color, you look at gender and race, it becomes double jeopardy when we see the use of policies and practices in the frame of these norms where we have expectations of girls' behavior. We also know that there are paternalistic attitudes that girls need to be protected, and that also plays itself out in policies and practices in our state and across the country. We see that girls are incarcerated for their own protection because they are high need and we know low risk to the community, but when there are no other alternatives, we will see judges openly in court say, I need to send her away to a residential program for services and for her own protection. And I can tell you, after 3 decades of sitting in court, I've never heard a judge say, I need to send this young man away for his own protection and for his safety. We've also seen that this idea of girls need to be protected has become a justification for advocating for locked facilities for trafficking victims, that we need to lock her in a facility so that she won't return to her trafficker. But our advocacy challenges that kind of attitude and says, we are not a state, we are not a country that locks up victims of rape and violence and trafficking. So from a programming and practice perspective, why it's important to look through the gender lens, we know that need drives behavior, yet we can often see systems are designed to control behavior and not to address the need. And this is at a tremendous cost to the well-being of girls and young women in our state.
Dr. Ravoira, before you move on to the slide, can I just ask for an example maybe of the kinds of infractions that girls are committing in this, 64% statistic that you're listing here? Just an example for the participants to see like what kind of things we're talking about that girls might be, committed for that maybe boys would not.
Thank you. That's a great question. One of the things that we see, and you also can see it in the research, is that girls are often charged with domestic violence. And we are huge supporters of the domestic violence laws, but when those come about, the intention of those was really around spousal abuse or partner abuse. And what we see happening is often in a fractured family where there is domestic violence happening and there can be chaos in the home when a police officer shows up. But because the teenage girl continues talking or continue arguing, what we're seeing that she gets arrested for domestic violence, when in the past that would have really been dealt with in the dependency side of work, and we would have been working to help heal the fractures in this family. A girl gets charged with domestic violence, which is a felony offense. Or we also see that girls have much higher rates of technical violations of probation than their male counterparts. And so often a girl may be pushed into the system for status offenses, running away from home, truancy, those kind of things at higher rates. But then there's a technical violation when she's put on probation for that, and she will end up being placed in a residential commitment program at much higher rates than males for a technical violation of probation. So that would be a couple of examples.
Great, thank you.
Oh, thank you, that was a great question. I will really want to share why right now in this COVID-19 pandemic that we are all navigating and figuring out day by day, strategic advocacy is really more important than ever, because the disparities that existed before the pandemic, those that I highlighted in some of the research and those that I'm sure that you all are seeing in your daily practice with girls, those are exacerbated now. We are seeing families under greater stress. We are seeing spikes in domestic violence. We are worried about the increase in child abuse, even though we're not seeing, some of the research is showing they're not seeing a spike in calls, but we're really worried about that. Because of the isolation and these calls aren't being made? Because often the calls are made by teachers in school who see it, and that's the gathering place for all of our children, or in our own social services programs where we see it. And is it hidden? We also know that the school transition to virtual classrooms was an absolute necessity, but for many of the young girls that we work with, they don't have access to technology. They don't have access to the resources that are in other zip codes. So it simply increased the disparities, and they are falling further and further behind in their academics. We know that girls were already feeling isolated. When you see 1 out of 3 girls in our state feel like life isn't even worth living, and 1 out of 5 are contemplating suicide, they're already feeling these incredible feelings of isolation. And now they're even more disconnected from the support systems that they had. The economic challenges across our state for families who are already challenged are resulting in a much higher demand for services. And As service providers, we're adapting as much as we can due to physical distancing, but this is a challenge for us to really provide the hands-on services that we know the girls and their families need. And so this increased strain is just adding more to a system that was already overstretched. And our funding is uncertain and the resources are scarce. And in many communities, they're not even available. We're seeing for the girls that we're working with who were already living in food deserts, the corner store, the shelves are bare and they don't have transportation to even get to another part of the city to get food. So these are all things that are happening now that aren't going to go away for the families that were already in crisis, for the girls that were already isolated and that were already feeling that life was hopeless. And so the Justice for Girls Florida initiative, we began by really translating our research to advocacy. We must have the facts, we must have the information so that we can really share the lived experiences of girls, not only in the justice system, but across the state. Those experiences of girls who are in middle school and in high school. And then we take that research and we translate that into an advocacy platform. And we began by raising awareness through strategic communications. And this is really done in partnership with the Children's Campaign. And they are positioned and have been doing this work since 1992 to not only use technology, but to use strategic communications through a political science lens. And so we've held numerous community briefings across the state of Florida, and that resulted in 36 pieces of media, local, state, and nationally, and we've had over 250 people attending these briefings. And these are just some of the important publications that happened as a result. And when we raise awareness, it is really educating citizens in our communities across the state of Florida so that they will get involved and they will make their voices heard for girls. And so we had coverage on television, in print, in the social media blogs across the state and nationally. And this is the beginning of really making girls a priority by informing our citizens, because we need citizens to raise their voices with us for reform. And these are some of our citizen leaders that went to Tallahassee with us, that met with elected officials to begin to advocate for the change that they want to see in our state and in our community. And moving forward, we are getting ready to launch the Status of Girls Florida Blueprint for Action 2020, which will be released in the fall. And this is a blueprint that looks at policies, processes, and programs to really address the significant needs of girls in our state. We will be convening a statewide leadership council that is patterned after the Justice for Girls Leadership Council here on the First Coast, that has resulted in incredible change because it is citizens coming together, working with us to address the complex issues, but with really strategic solutions. We are expanding our digital online presence because we know that's more important than ever during this pandemic. We cannot let girls go back in the shadows. We must keep the needs of girls in the forefront of policymakers and of citizens who have the power to change how our state responds. We are monitoring the 2021 budget, which hasn't been delivered to the governor right now. We know that there's a downturn, obviously, with the closure of the state of Florida and our reliance on sales tax, but we want to make sure that there aren't cuts that are on the backs of girls and young women in our state. We will be calling for a Status of Girls hearing in the 21 legislative session, and we'll be expanding our focus to not only include juvenile justice, but to include all girls across our state. And we're fighting to make sure we don't lose the gains that we've already made. In 2012, we passed the Safe Harbor law that says you cannot lock up victims of trafficking, that we must make sure that survivors have access to services. In 2014, that law was challenged, and we almost went backwards to the idea of, for their own protection, putting trafficking survivors in locked facilities. We have to stay vigilant that we don't lose ground. We have launched the Open Doors Outreach Network, which is now in 36 counties. We hope to expand that even more across the state of Florida. And so these are just some of the examples that we want to make sure that we continue moving forward. And we must address the disparities in child welfare. Just this last session, we fought to stop a very bad bill that could have moved forward, that would have placed hard to place foster care kids in locked facilities. And this is bad practice. We have to do better. We can recognize the needs of the foster care kids, but it's our responsibility to make sure that we are aligning need with the placement. And we also want to make sure that we're looking at the suspension, the disparities that are happening in education, as well as the just urgent need for mental health services in our local communities. And what you can do, these are some ideas that we're asking those of you who are on the webinar, is to join our movement, to be part of the Justice for Girls statewide initiative. You can go to seethegirl.org or iamforkids.org and learn how to become part of the movement. We would invite you to work with us to host a community briefing in your community so we can lift up this important topic to citizens locally. And we would certainly share the research, but we would customize it to let people in your community know what the status of girls is locally. And we also would want to include your input in the Blueprint for Action and our advocacy platform for 2021. And with this COVID-19 virus, we know that the needs and the isolation of girls is greater than ever. So it's more important than ever that you join the movement and be part of lifting up what's happening to girls. Your voice is needed for the very lives of girls in our community and statewide. And I will end with just what girls want us to know. And these are some of the quotes from girls. And I won't read them. I'll just pause and give you a moment to read them on your screen, because I think it's critically important that we always remember behind the statistics, behind the advocacy platform, are girls who are counting on us to stand with them, to make our state a safe, welcoming place for them to grow and to know that there are opportunities that truly can make their dreams come true.
Okay, so thank you so much, Dr. Ravoira, for such a insightful presentation. So I attended the conference that you had back in, I guess it was October of last year. And that was the first time that I had learned about, the details of the research. And I just remember feeling maybe a little bit overwhelmed and just really jarred, I think, by everything, that the research uncovered. So, thank you again for what you've done. So I wanted to maybe ask a couple of questions, and then if anyone has questions, any of the participants, please go ahead and submit them through the Q&A feature located at the bottom of your screen. So one question that came in from a participant was, how large is your organization? So can you tell us a little bit more about how your staffing is structured, how many staff you have on the program side and advocacy and all of that?
So the Policy Center, with the 4 tiers, and I'll let you all know that I transitioned in March to President Emeritus, which means I'm really focusing my attention on the national and the statewide advocacy work. And Vicki Basra is the President and CEO. And the Policy Center, and I'm looking at Blythe to make sure, I think we have 24 employees. I should have known that right off the bat. I was going to say 22, but 24 employees. And the larger part is in programming staff. And so we have therapists, we have care managers, we have survivor mentors, regional advocates who are doing the direct service work. And so I think there's about 13 or 14 direct people who are doing the programming work. And then we have 2 people who are in research, and then obviously the staff who are doing just the operational work and the advocacy work. And that's why our partnership with the Children's Campaign is critically important, because we also leverage the expertise of the Children's Campaign to really lift up our advocacy work.
And how many girls, I guess, would you say you serve like in any given year within the state of Florida?
So in any given year, since we've opened, we've served over 2,000 girls. And I think within any given year, so in any given month, it's 200 girls. And so what makes a policy center a little bit different, I think, than other organizations, there's not like you get 6 weeks of service or 6 months of services. We know that crisis for girls, the girls that we work with, these are girls who've often cycled in and out of every other program locally. And so we really work with them for a long period of time. So for some girls we've been working with for 4 years, because when the initial crisis is over, things may settle down, but then there's another thing that may happen in their life and they need an intervention or support services at that time. And so the majority of young people that we work with, it's intergenerational poverty, and the impact of that and the disparities aren't solved in a 6-week or a 6-month period.
Sure. And how do these girls learn about your organization and also about the programs?
So a lot of it is word of mouth, but the staff do, they set up at different events. There's a lot of outreach to schools, to probation officers, to state attorneys, to judges, across the spectrum. And so we would really invite anybody. You can go to our website and make a referral. There's actually a referral online. So it's social media posts. It's like the networking with all of the different social services agencies, the schools, and individuals where girls would learn about the information. And also we take referrals from anyone, from judges to parents to the girls themselves.
And are the programs, I guess they are free, so the fundraising that you do and all of that is really to cover programming services?
Yes, the services to the girls and their families are absolutely free, and we do a lot of private fundraising, but we also have contracts with the Department of Juvenile Justice as well, where we're able to provide prevention as well as for girls who are at risk of entering the justice system, but also we have programs with the Department of Juvenile Justice for the girls who are already in the programs, who are already in the justice system.
Okay.
And then the Open Doors outreach is specialized services for trafficking survivors. And those referrals also come from just all over, from individuals themselves, from judges, from state attorneys, from schools. And it's that we serve up to age 24 in that program. So 4 to 24 years old. It's a wide range of services that we provide to girls and young women and youth who identify as female.
Okay. So another question just came in from a participant. So Lori's asking about whether or not you've expanded into Palm Beach County. So if you could just speak a little bit to kind of your operational area.
So in Palm Beach County, we haven't expanded into Palm Beach County, but we do, in addition to the work that we're providing in this community, the 5 county areas on Florida's First Coast, we do work with the public defenders and in Palm Beach County, and we'll often get calls and really help with trying to advocate for specific girls in that county. We would love the opportunity to come to Palm Beach and do a community briefing, which Jennifer and I have talked about, and to really learn what are the needs in Palm Beach County, because our model is about joining with the community and not assuming that we have all the answers, but really hearing from the stakeholders, hearing from the girls to really understand what are the specific needs in your community, and then working with you to make sure that the policies and the processes, as well as the programs, are really aligned with the specific needs of girls in your community. And we are more than happy to share our resources and our experiences.
Yes, I definitely think we want to talk about ways to hold a briefing here, whether it's virtual, I guess, depending on the timing, most likely. But yes, we absolutely want to be able to support you. You know, beyond the funding, we at JWF, we really like to partner with our grantees as much as possible to make the work, you know, as effective as it can be.
Well, that would be great, Jennifer, because the more that we can have individuals across the state informed even about what's happening to girls in their own community, and what else do we need to be looking at through a research lens? What are the things that are top of the minds of people in Palm Beach County that we may not be hearing in other parts of the state, or it may be reinforcing you're having the same issues that we're seeing across the state of Florida. It elevates the issues so that we can make sure that policymakers are working with us and we can be strategic in our advocacy platform.
Sure, and I think that we did see that on the slide, that, you know, Palm Beach County more or less is reflecting what we're seeing on a statewide level. So I want to talk to you a little bit more about the advocacy process and kind of what that looks like on your end. And then also, if you could maybe share some stories about successful advocacy work that you've done, because I think that, you know, a lot of the time, at least for me, when I see statistics like this, it's a little overwhelming and you feel like it's such a big problem. How are we ever going to make a difference? I think it's always helpful to hear about what's been successful and sort of what you've seen improve, you know, since the organization began.
Well, our advocacy is really aligned with political science. And as I've said before, we do it in partnership with the Children's Campaign. So we begin with the research. What is it that we are seeing that really needs to change? And what is most urgent that needs to change? But also, what, from a political perspective, what can we move through the political process from a policy perspective? And I would share one of the greatest successes that we had was working to get the legislation passed for safe harbor. And I mentioned that briefly in 2012, because prior to that, we were meeting girls in detention and in lockup who we knew were victims of trafficking. And yet we were further isolating them and really re-traumatizing them by not providing them with the services that they need. But it isn't enough just to get the safe harbor law passed. We have to then, because what was happening, everyone was supporting the safe harbor law, but then when there wasn't a service network to be able for judges and others to refer to so that trafficking survivors could get the support systems that they needed, we saw the reverting back to girls being locked up for their own protection. And so with that, we had to move to, well, what's the service network? So we actually, the Children's Campaign and I did 3 years of research going across the country to see what's working in other parts of the country and what can we bring to our own state. So we looked at best practices for programs and services, and then created the Open Doors Outreach Network, and then did intensive advocacy for the funding so that we could launch Open Doors across the state. And as I shared, it's now been replicated in 32 counties across the state, 32 or 36 across the state. And we want to continue that. I mean, ideally, we would like to see Open Doors in every county across the state of Florida, because what we learned and what we advocated for, we know that trafficking survivors are moved all over. So if a young girl is picked up in Palm Beach County, but she's from Duval County, we want to have just a handoff that is absolutely seamless, where she knows she's going to get the same services when she gets home, and have the connection with the survivor mentors and the therapists and the regional advocates that she met in Palm Beach County. So that's certainly one example. We've also worked in the past, and specific to Palm Beach, the Florida Institute for Girls, which was the first prison in the country to be built for girls. And it was a 125-bed facility. And we fought to stop that from opening. And we were not successful. We couldn't stop it from opening. But many people in your community and across the state are familiar with the abuses that happened there. So our advocacy worked to shut it down. And we were able to shut it down in 2004, I think, 2004 or 5. We shut that facility down through advocacy. We also worked during that time, and we got legislation passed where Florida became the second state in the nation to pass legislation that mandated gender-specific services for girls in the juvenile justice system. And so that was critical. We need the law behind us in order to then move forward with working for the appropriations to have the direct services and the policy shifts that need to happen in our state to make girls a priority. So, others is with the Children's Campaign, we work to pass the confidentiality of juvenile records and the expungement of some juvenile records, because we know things that kids do, stupid things that they do as teenagers, can impact their ability to get jobs, to go to college, to get scholarships in the future. So those were some of the other laws that we were able to get passed with the Children's Campaign that had a significant impact on the futures of children.
Okay. Yeah, that all I think is really amazing. And I think it's so important that applying a gender lens is something now that's happening. And it's definitely something that we talk about a lot at JWF. And I think that, sometimes that concept can feel really abstract to people, like what does it mean to apply a gender lens to something? But I think that your work gives a good example of what that means, to be able to look at services and see how they're affecting girls differently than they're affecting boys. So one of our participants raised her hand. So Marty, I'm gonna unmute your microphone so you can go ahead and ask Dr. Ravoira a question directly. Okay, Marty, you are unmuted. Oh, and maybe she raised her hand by accident.
Can you hear me?
There you go, Marty, we can hear you.
Okay, I wondered if Dr. Ravoira could share a little bit of her own background to get her to this place.
Sure, thank you.
Well, thank you, Marty. Well, I really started this work more decades ago than I like to admit, but in the 80s, I worked at Covenant House in Fort Lauderdale, and I have to admit I was working in a co-ed facility and had not really thought about gender responsive work. But at Covenant House, I had an opportunity to work and develop the mommy baby program there, and I began to see the disparities of girls. And I also had to do my own reflection and realize that I really wasn't even able to name 20 women who had influenced history in our country. And it was that self-reflection where I realized that it was bad enough that I couldn't name them, but I had really not been aware enough in my own life to ask why I wasn't being taught about women, why my books weren't written about women, why I wasn't seeing images of women that I could aspire to be. And so that became a personal transformation for me. And then I had the opportunity to I met Vicki Burke, who was the founder of PACE Center for Girls, and started doing some consulting for PACE, and she asked me to take over the agency. And so for 14 years, I worked at PACE, which is where I really learned from the girls the importance of giving them a space, their own space to grow. And from at PACE, I saw that PACE was designed to really work with girls to help them academically. And actually, I opened the PACE program in Palm Beach County, and was
That's
able.
amazing. And they're actually one of our grantees this year.
Yeah, and so I opened, had the honor of really opening PACE programs across the state. But then I really realized that there was a group of girls that we were not successful with at PACE, and I was meeting them in residential lockup. And so I had to step back and realize PACE wasn't designed to meet girls who had the level of intensity of need of mental health issues, and that some of the girls that I was seeing continuing to move in and out of lockup. So I then made the decision that with this last part of my career, I really wanted to focus on that population and create a space where all girls would have this opportunity. So, I'm first generation college. I had incredible, strong women in my life who I saw struggle, but they continued to just be devoted to their families. And so for me, it was this opportunity of paying back and being able to hopefully make a difference in the lives of girls who, like me, had never had a vision that college was even something that was on the radar screen. And so I wanted to open up the world as best I could, as it had been opened up for me.
Well, thank you. So we are coming up on 11, so we're just going to wrap up this webinar. So thank you so much, Dr. Ravoira, for being here with us today. And thank you so much for everything that you've done for girls. And certainly we extend that thanks to everyone on staff at Delores Barr Weaver Policy Center. So again, for our participants, the website is seethegirl.org, SEE, thegirl.org.
Thank you, Jennifer.
Yes, so I really appreciate everyone being here with us this morning for Impact Tuesdays. To learn more about JWF, please visit us online at jwfpalmbeach.org. As always, I'd like to remind everyone that we are 100% funded by individual donors, so please consider supporting our work, which you can do through our website. We look forward to seeing everyone next Tuesday, and we will certainly keep providing updates about Delores Barr Weaver and all of our other grantees. So thank you again. Please stay safe and be healthy, and we'll see you soon. Thank you.